Prepare for Exam 1, Strategies to Answer Questions You Do Not Have the Answer to, narrated by Carissa Enright. I know the exam is not exactly like the Olympics, but I want you to think about the exam as a challenge similar to a sports event. Right up to the last minute, these athletes plan out their day to be at their very best for the short time they must challenge each other for the gold. You must be testing fit and ready for the challenge. Use these last 24 hours before an exam in productive preparation. Study all you want the day before the exam, but stop your study at 5 p.m. This means put away all notes and don't open them again until after the exam. Go get aerobic exercise, something designed to work off the stress of the day and get your body exhausted enough to help your sleep. It's very important that you avoid alcohol and any sleeping medication that you may use for sedation. Both alcohol and the benzodiazepines will give you amnesia. Instead, prepare for sleep with the usual sleep hygiene measures you teach your patients: a hot bath, hot cocoa, dark room, earplugs, relaxation exercises, and arrange time to get at least 8 hours of sleep. On the day of the exam, you need a protein breakfast, and if the exam is afternoon, eat a light lunch. Then, if at all possible, find a quiet place to take a 20-minute nap or rest. You want to achieve complete relaxation. Show up in the exam room at 100% fitness. If you have the flu or a fever, stay home and notify your instructors you will not do your best and you could infect others. Now for testing tips. Mild to moderate anxiety is helpful. You need to be a little nervous to stimulate your brain. But moderately severe anxiety is not helpful. Higher levels of anxiety command all the energy of your brain and will rob you of critical thought. During the exam, you must manage your anxiety. The most effective strategy for managing mood uses the simple process of controlled breathing. Do not forget to breathe. Then there are some strategies that can empower you. There is a TED Talk on using the power pose to give you a boost of energy. It may seem silly, but try out a power pose for a minute or two as you prepare to take that exam. And positive self-talk will help. Remind yourself that you are in nursing school. By definition, that makes you smart and capable. You can do this. Last of all, smile and look up. Research has proven that looking up lightens your mood. All these things will help. Now, time to approach the questions as your friends. The test writer very carefully crafts each STEM and answer choice with clues that can lead you to the correct answer. Here are some tips on the clues to look for. I will start with the word first as part of the STEM. The nurse approaches a new admission in the lobby before taking them to the unit. What does the nurse do first? Check the immediate environment for sharps and escape routes. Smile warmly and make eye contact. Orient the patient to this new environment or reassure the patient he will be safe here. In this case, the question is testing if you can see that safety is the first priority in nursing. Before doing anything else, securing the environment is first. But first is not always about safety. The nurse coming on shift hears report on 4 patients, which requires the nurse's attention first. A schizophrenic patient who has a high fever and catatonia, an alcoholic in day 2 detox complaining of jitters, a suicidal adolescent on one-to-one suicide precautions, a manic patient who disrupts the milieu with loud singing and provocative dancing. In this case, the question is testing for setting priority of care. All these patients need nursing care, but one will need the attention of the nurse before the others. If you look at the clues given in the answers, you will see that the fever and catatonia gives the first patient an immediate need to assess for a hidden infection. Here is another use of the word first. The PCT tells the charge nurse, "Come quickly, a patient is getting ready to hit somebody." What does the nurse do first? Prepare PRN medication for aggression, call in a show of force, approach the patient to assess the situation or isolate the patient from others. This is a question testing for your knowledge of the nursing process. Look at the answers. You have 3 interventions and only 1 assessment. When you see the word first, look at the stem to see if you are being asked to assess before acting. In fact, certain questions are written to test for each of these steps of the nursing process. Once you get used to the formats used to test for these steps, you will have a new way to analyze questions. Having seen a question on the step of assessment, I will skip to the analysis step. These often ask for a nursing diagnosis. The questions that ask for the nursing diagnosis are often the most difficult questions. The STEM must include all the data you need to determine both sides of the nursing diagnosis. Remember, nursing diagnoses are written in the form of response related to etiology. The second half of the diagnosis must relate to the first part, and it is often causative. It's important that you do not add more data to the question. If you think you need more data to answer these, you don't. The STEM has all you need. A patient diagnosed with paranoid schizophrenia has suffered a relapse in delusional thinking. For the past 2 days, he has locked himself into the bathroom without access to food. What is the priority diagnosis for this patient? Self-care deficit related to altered thought processes, altered nutrition related to schizophrenia, at risk for suicide related to self-care deficit, altered thought processes related to isolation. Of course, the priority diagnosis will always be the one that might result in death or injury. However, the STEM must contain all the data you need to determine if the most serious diagnosis is justified. In this case, suicide must include the intent to take one's life. This person is not trying to die, so the risk of suicide is not supported. The correct answer has data for both sides of the diagnosis. He's not taking care of himself, and he has delusional thinking, which is altered thought processes. The second answer has evidence for the altered nutrition, but nursing diagnoses do not use a medical diagnosis like schizophrenia. And the last option has the data for the altered thoughts, but his isolation is a result of those altered thoughts instead of the cause for them. This question tests for the planning step of the nursing process. This usually translates into goals or outcomes. A patient with OCD has chapped hands because she spends 5 to 10 minutes washing her hands. What is the short-term goal for her? The patient will reduce washing to 2 minutes. The patient will recognize this behavior as obsessive by discharge. The patient will take prescribed medications for her compulsions today, or the patient will improve skin integrity by day 2. Before you can write a goal, you must have a problem statement. In this STEM, you have a medical diagnosis that describes a pattern of moods, thoughts, and behaviors. This gives you a very vague idea of the problem, but the rest of the STEM defines the problem particular to this person. In this case, the chapped hands are the problem. Therefore, the answer must include something about her skin. If you get good at looking for the problem, these questions should become easier to analyze. Most questions in nursing involve the implementation step of the nursing process. As you approach these questions, you need to remember that 3 steps come before intervention: an assessment, an identified problem, and a goal for action. All of these steps will be in your STEM in one form or another. The nurse and a patient with depression establishes this goal: the patient will not harm themselves today. Which intervention will meet this goal? The patient will faithfully take all medications as prescribed. The patient will attend suicide prevention classes. The nurse will make sure the patient is observed every 15 minutes today. The nurse will remind the patient to write his feelings in his daily journal. Before we go any further with the analysis, I want you to notice how the answers are worded. 2 start with the patient and 2 start with the nurse. All implementations start with the nurse. Any statement starting with the patient is a goal statement. Now you have reduced your decision to only 2 alternatives. This time your job is made easy because you have a goal statement. The answer will address the goal. The goal in the STEM says nothing about feelings. The only intervention that will keep the patient from self-harm is the 15-minute observations. The evaluation step of the nursing process requires all the other steps. For these, you must determine the goal for care before you can evaluate it. A psychotic patient was committed to treatment because he was too frightened to leave his bed for 2 days, refusing food and soiling his bed instead of going to the bathroom. What shows the nurse he is ready for discharge? The patient leaves his bed to void and eats food brought to him. The patient takes his prescribed antipsychotic medications. The patient allows a nurse to accompany him out of his room for a walk in the hall, or the patient talks to other patients. The STEM clearly states the reason this patient needed treatment. The only behavior that addresses his problems with eating and voiding is the answer to this question. The unique quality of the evaluation question is the ability to ask the hidden except question. The nurse teaches the parents of the 20-year-old bipolar patient about the lithium prescribed to control mood. Which statement made by the mother indicates the need for more teaching? I will call his doctor if I notice that he is stumbling. He will need to be careful not to get dehydrated in this Texas heat. I will need to learn how to make his favorite foods without added salt. Or he will need to remember to take his medications on time and not double up if he forgets a dose. It is vitally important that you understand that you are required to find the wrong or incorrect answer. When I'm taking an exam, I will actually mark each answer as true or false to make sure I don't automatically choose a true answer by mistake. And then there are those questions where you might say to yourself, I would never say that. In the ER, a patient comes for treatment of a gash in his foot sustained when he stepped on an empty beer bottle 10 hours ago. He's clearly intoxicated with a strong alcohol smell on his breath. How should the nurse start the assessment? How long have you had a drinking problem? What medications are you taking? Did you throw that empty bottle on the floor? What can we do for you today? When you don't like any of the answer options, it is important for you to think through the purpose for each answer choice and then search the STEM for the clues placed there to help you discover the answer. Looking at the first option, will your care plan be changed if the patient says 1 day or 10 years? If the length of time does not help you right now, it's not an essential part of the assessment. And the question about the bottle doesn't help at all. So you must decide between asking about medications and the patient's perceived problem. The clue to which to ask is in the STEM. If this person waited 10 hours with a bleeding foot, what exactly did the patient want from this visit in the ER? Finding out what the patient thinks is important to the care plan. Last but not least, the questions are not always about a specific step of the nursing process. On all nursing exams, you need to look for reflection of feeling. The patient says, I always have complications after surgery. Would you have this surgery if you were me? Choose the therapeutic response. What would your family want you to do? How many surgeries have you had? It sounds like you're nervous about surgery. Or if I trusted the doctor, I'd have the surgery. Even if you don't think the person described in the STEM is nervous, using a feeling word, even the wrong feeling, is the therapeutic response. Points to remember. Do not underestimate yourself. You are intelligent and capable. You don't need to get all the answers correct. Allow yourself to be imperfect. Even your instructors did not get 100% on their exams. Memorization is not helpful. Don't waste your time on the facts. Critical thinking does not require you to know all there is to know. And most importantly, arrive at the exam in the best health you can muster. Be ready to use critical thinking to determine what the question is testing. I never say good luck before an exam. Luck has nothing to do with your grade. Instead, I hope you feel prepared and ready to shine.